So I can start by confirming that today we have 39 new confirmed cases of COVID-19 and 28 new probable cases. There are no additional deaths to report, and we now have 176 cases of COVID-19 who have recovered from their illness. So the new combined total of confirmed and probable cases in New Zealand is 1,106. And this is an increase of 67 in total from yesterday. Today we have 13 people in hospital, including 3 in ICU. 1 is in Wellington and 2 in Auckland. 2 of the people in ICU are in a stable condition and 1 is classified as being in critical condition. And 2 people have been discharged from hospital since our update yesterday and are recovering at home. Testing continued apace over the weekend, and from our lab numbers we can report a 7-day rolling average of 2,846 tests per day. The total number of lab tests completed now is just under 40,000, and yesterday there were 3,709 tests completed. This is one of the highest number of tests for one single day, and our capacity, of course, continues to increase and remains ahead of the testing level. In terms of community testing, we have from today 65 community-based assessment centres in place and 48 designated swabbing centres. Some information on the origins of the cases overall. We now are finding 43% of our total cases have a direct link to overseas travel. 38% are close contacts of other confirmed cases, and we are classifying 2% as confirmed as community transmission. The balance are still under investigation, and those the highest numbers under investigation are in our district health, 3 of our district health boards with the highest number of cases in the Auckland Metro region, in Waikato and in the southern region. So we're going to be working with them over the next day or two to look at each of those cases under investigation to determine whether they can or should be classified as community transmission. In terms of ethnicity breakdown, we've got 73.5% European, Asian ethnicity is 8.4%, Māori 7.8% now, and Pacific peoples still quite low at 3.4%. The balance, the ethnicity, is unknown. All the information around these aspects of the demographics of the cases, as well as more detail on the cases, will be on our website. Clusters. I know there's ongoing interest in clusters, and that is where we have a group of cases that all are related to either a place or an event, or in the case of one of them, a cruise ship, that is the Ruby Princess cruise ship. We classify a significant cluster as one where there are at least 10 people involved, and we currently have 12 significant clusters. The ones with the highest numbers are today the Maris cluster in Auckland, that now has 72 cases, the cluster from the Bluff 62, and the Matamata cluster, which is 58. I also have a little bit more information about the new cluster in Christchurch, which I talked about yesterday. This is associated with the Rosewood Rest Home or Aged Residential Care Facility in Christchurch. There is so far a total of 15 confirmed and probable cases amongst residents and staff. And I spoke last evening with the District Health Board Chief Executive, David Mates, who updated me on this, and senior clinical staff had been into the facility during the day to assess the picture there, the ability to safely look after and isolate residents and also staff that facility. And on the basis of their assessment, they've decided to move 20 of the residents to be cared for at Burwood Hospital by the DHB staff to ensure that they can be looked after appropriately, and or strict self-isolation for those who may be close contacts can be maintained. And likewise, they have put in a DHB person into the rest home to supervise the care of the remaining around 40 residents to make sure that appropriate infection prevention control, including appropriate use of PPE, is happening there to look after and care for those other remaining residents. Just on contact tracing, I've talked about our efforts over the last 2 weeks to shift to and stand up a national close contact tracing centre. That's gone very well, and we now have 190 staff who are providing the service out of the Ministry of Health. I've also mentioned that we've moved what was a very manual process done locally onto a national electronic platform, which allows us to link that those contact tracing efforts with our other health care databases. And something that's of particular value here is to be able to link to our National Health Index, which has very up-to-date information on contact details for New Zealanders, because those details are updated with their general practice, and that upload happens every month to update the NHI. So that will assist us in being able to identify and track close contacts in addition to the other ways we have of doing that. And the other role for technology, which is really a complementary role, is the use of mobile phone and digital technology, which we are looking at apace, and we know other countries are doing this to help look at the movements of people if they become a close contact, and it helps to recall others that they may have been in close contact with during the preceding time when they may have been infected or infective. So just a key point here is that the mainstay of that close contact tracing remains our call centre and that human-to-human contact, the phone calls, emails, but in particular phone calls to talk with people about what the expectations are on them and what symptoms to look out for, and of course the daily check-ins to see if they have symptoms. And a final couple of comments from me. I gather there's still a little bit of confusion about the use of the terms self-isolation, quarantine and the bubble. So here's how we're using them. We are using quarantine to describe when someone comes in from overseas and they are symptomatic, and they are then assessed and taken to a quarantine location, which is a hotel in Auckland, where they are tested and then of course cared for if they have symptoms, and they remain in that location for the full 14-day period, even if their test for COVID-19 is negative. In terms of self-isolation, this is people who are close contacts, whether they are already in New Zealand and have been identified as a close contact of one of our new confirmed or probable cases. And self-isolation means being in your own home and also isolating from the other people who are in your home so that you are not risking passing the infection on to them. People in self-isolation, yes, can go out for a walk around the block or do some local physical activity alone and should not have any contact with other people. And then we have, of course, our bubble situation, which is what we are all in as Kiwis at the moment under the Alert Level 4, which is where we know we're quite clear around what's expected of us and to make sure that we are only having close contact and physical contact with those in our bubble while we're in this alert level. And finally, some reports that people who require health or medical care for other conditions, not COVID-19 related, who may be delaying seeking treatment because they may be worried about leaving the house and that they would be at risk. Please, do not delay seeking treatment for any condition. If you feel you need help from either Healthline or your GP, ring first. Healthline will be able to provide you with advice about what is the appropriate thing to do. If you are very unwell, for example with significant chest pain or other problems, then you should dial 111 and get an ambulance. If you feel you might need a visit from your GP or to visit your GP, many GPs are now able to provide a consultation online by phone or by video, and that is an option. Or if you do have to go out and visit, they can ensure that you are kept safe throughout that visit. They all have very good processes in place. So please do not stop seeking care that you might need for any medical condition that you may have, whether it's a new acute condition or an exacerbation of an existing condition.